Hi, my name is Carrie Bedient and I'm a physician at the Fertility Center of Las Vegas. Today we're going to talk about options for fertility preservation for patients who have undergone cancer treatment or who are about to go through cancer treatment. Chemotherapy and radiation are both toxic to germ cells, specifically within the ovaries and the testicles for the eggs and the sperm. If you or someone you know is going through cancer treatment or about to go through cancer treatment, time is very important. When at all possible, we try and do fertility preservation treatments before somebody starts going through all of their cancer treatments. For men, it's a relatively simple process. The first thing that we do is we get a semen analysis to show how much sperm there is, how many are moving, and how many have a normal appearance. Once we have that initial semen analysis, we then go on to freeze the sperm, and we can later use that sperm in either in vitro fertilization or in intrauterine insemination cycles. We try and get as many sperm samples as we can before someone undergoes their chemotherapy or radiation in order to have as many options for the future in building a family as we may need. For women, the options for fertility preservation take a bit more time and are a bit more involved. We can either do egg freezing or embryo freezing in order to preserve a woman's fertility. When we start the process of egg freezing, the way that we go about it is we stimulate the ovaries with injectable medications in order to get as many eggs as possible to grow. We monitor the eggs' growth by checking frequent labs and ultrasounds over the course of about 2 weeks. During that time, you're frequently coming in for lab work and for ultrasounds in order for us to monitor the egg growth. As we see that the eggs are growing much larger, we'll give you a trigger shot. That is to finish off the maturation of the eggs. 2 days later, we'll do a retrieval. The retrieval is done under sedation so that you are very comfortable during it, and we'll put in a vaginal ultrasound with a needle on the end in order to go in and pick up all of those eggs. Once we pick up the eggs, they will go to the lab and will be frozen at that point. Or, if you have a partner or a sperm donor that you would like to use, they are fertilized and then frozen for future use. You will come off medications and will be able to go back to your chemotherapy, radiation, or other cancer treatments as scheduled. Our goal for this process is for it to take as little time as possible, in general about 2 weeks. There are other options for fertility preservation during cancer treatment as well. One of those options is ovarian suppression during the course of your chemotherapy or radiation, and that's done by giving medications every month or every 3 months in order to reduce the blood supply to the ovaries. Another option, particularly for patients who are receiving radiation, is to move the ovaries out of the field of radiation so they are not hit with quite as much radiation as they otherwise would be if they were left in their original positions. There's another option, which at this point is still experimental, which involves removing some ovarian tissue, freezing it, and then transplanting it in later once the patient has gone through all of their chemotherapy and radiation treatments successfully. At the time of the consultation, we would discuss with you your cancer treatment and plan and go through your prior history to determine what the best option is for you and for preserving your fertility. For patients who have already gone through chemotherapy and have already gone through other cancer treatments, there are still options in order to preserve your fertility. Many times, the fertile window for those patients is smaller than it would otherwise be if they had not had those cancer treatments. For men, it can take a few years for sperm production to return back to normal, if it returns to normal at all. What we would do in that situation is do a semen analysis, find out how much sperm is present, and then from there determine if we needed to give additional hormones to try and boost sperm production, or if there was a very limited supply, if we needed to obtain the small amount of sperm that we could and directly inject it into the partner's eggs in order to fertilize embryos and to help build your family that way. For women who have already had cancer treatment, oftentimes the best type of stimulation is very similar to the stimulation we would do before they undergo treatment. We stimulate the ovaries, get as many eggs as we can, freeze them, or fertilize with the partner's sperm and freeze the resulting embryos. The goal of this treatment is to get the eggs out as soon as we can before the woman loses the opportunity to use them in the future, so that when she comes back and when she wants to build her family, she has the option to do so. For men and women who have had such significant damage to their testicles or ovaries that we are unable to obtain sperm and eggs, we're able to use either a sperm donor or an egg donor in order to help them build their families. For women who have had treatment that damages the uterus or that removes the uterus, particularly radiation or surgery, we have an option of using a gestational carrier, which is also called a surrogate. A surrogate is a woman who carries a pregnancy for a couple who cannot carry a pregnancy for themselves. If you have undergone cancer treatment or are about to start cancer treatments and are interested in preserving your fertility, please give us a call today so that we can discuss what options you have available to you.